Hi there, I'm Janelle Marie. Welcome to Body Beautiful, the show where we talk with local professionals about the latest in cosmetic procedures and medical devices. With us today, we have plastic surgeon Dr. Joseph Mealy. We're talking about a couple different procedures today. First up, breast augmentation, followed by gynecomastia reduction, arm lifts, and then finally chin augmentation. Lots to talk about. Before we get started, any advice we give you today, remember, consult your own physician. All right, let's jump right in. You are our local professional, Dr. Joseph Mealy. Thank you again for joining me.
It's so nice to be here.
It's always so much fun with you.
And thanks for having me.
You're welcome. All right, breast augmentation.
Yes.
Been reading a lot about it. Most popular plastic surgery procedure is this. Really?
Yeah, the statistics just came out a week ago from
Yes.
2016, and it's still number one.
All right, so why is it number one? And why do people need breast aug?
Breast augmentation is helpful for two situations. One where breasts are just small and never really developed.
Okay.
And the other is often women have breasts they're very happy with before having children.
Right.
And
Oh,
after having
yes.
children and breastfeeding, they change. So we can restore what was there before.
All right, so when you go in for a breast augmentation, how do you know if you need just the breast augmentation or if you need to lift them? Because those are totally two different procedures, am I right? Or
There are different procedures. The breast augmentation will essentially enhance whatever shape is already there.
Okay.
So for someone who's flatter, the skin is tight, usually breast augmentation is perfect. Just works very well.
Right.
There's also a type of sagging where the nipple's still high, but the breast is kind of bottomed out.
Yes.
Breast augmentation alone usually works well for that.
Okay.
But when the nipple's low, we want to change the shape of the breast.
You don't want the nipple low.
And
You
it's as
wanna-
high as 40% in some of the studies.
It's high as how many percent?
40%.
40%.
Of the time when we're doing augmentation, especially after having children, where we're adding a lift.
You got to do the lift. But the lift still has the scars. You're going to
Lifts
still have the scars,
yes.
but
So
they do
obviously
fade.
there's a small scar when we do breast augmentation.
Yes.
When we do a lift, we're usually moving the nipple. So usually there's a scar around the nipple.
Gotcha.
And if the nipple is very low, then there may be a vertical scar because that's where the nipple used to be.
little T-scar.
And if there's a lot of extra skin, then often we'll add that incision along the bottom in the inframammary fold.
All right, let's go to the pictures. Everybody
Okay.
loves the before and afters. First one up. There we go.
Okay. So
We need a monitor,
This
though.
is someone who has smaller breasts, always has had smaller breasts.
Yes.
And you can see on the upper part of the breast, there's a lot of loss of volume.
Yes, big time loss of volume on that
the
one.
implant helps to smooth that out. This implant is placed behind the muscle, which
That's a
gives us a nice
beautiful after,
teardrop
yes.
shape. And again, her skin is not redundant, doesn't need a lift, just needs the volume.
So that was
placed
just the
back in.
augmentation.
Yep.
That, that is really good. Sometimes if you see augmentation, it looks like there's too much up above. You get it nicely, so that's a nice natural shape.
It's about choosing the right profile. Some implants have, sort of a taller look for a smaller
Right.
diameter, and others are the other way around. So in this case, this is someone who has pretty good shape to her breasts already, but sort of lost that upper outer quadrant and has that little fullness underneath the axilla, the armpit there. So the implant just balances out that area.
And that's just an augmentation, no
Just
lift.
augmentation. I've
can't
moved
see the
inframammary
scars.
fold a little bit to get it a little closer
Okay.
together and
That
to
looks
smooth out the
good.
roundness at the bottom.
All right, picture number 3. That is a really good. Here. Oh,
So this is someone
nice,
also
too.
kind of looks a little deflated before, but again, the nipple's in the right place. So
Oh, really? So
don't need
no
to do
lift.
a lift, just adding volume.
Now, when you get an augmentation like this one,
Yes.
it looks like the stretch marks seem to appear better.
Well, they smooth out. They're still there.
Okay, they're still there, but they look a little
In rare
better.
cases, breast implants can actually cause stretch marks,
Oh,
but it's not
that's
common.
not good.
But if there are stretch marks, often they're more visible because of the irregularity in the skin, because the skin's a little deflated,
Mm-hmm.
and placing the implant in there smooths it out because it fills it back up.
And I see or here's the next pic, and I can see a little, one breast is smaller than the other, so
Very common.
when you get the
Yeah.
augmentation, does that nice, you can even it out with?
If they're close, we tend to just use the same implant size, and that's because percentage-wise, the difference gets smaller.
Mm-hmm. Right.
If it's a cup size difference, then we may need not only different sizes, but maybe even different profiles to
Okay.
help even that out.
And as we go to the next picture, what are the downtimes?
So downtime for lifting, heavy lifting, like kickboxing sort of workouts,
Yeah.
about 6 weeks.
Okay.
That's the long-term downtime. For walking, moving around, I want people up moving the day of the surgery. So
Oh, really?
I don't want them stuck in bed or feeling like they have to be. Yeah, the better they move, the less likely they are to have other problems. So
All right, so when you get scars on breast lifts,
Yes.
talk about scars and how a lot of people, I don't want to go have that surgery because I don't want the scarring. Very concerned with the scarring.
Sure.
But if you get the breast lift scarring, does it eventually go away, change color, or can you do something about the bright red scar?
it gets better with time. Like
Okay.
any cut, it's kind of bright red at the beginning, and then
Right.
it takes a little while for it to calm down. And it can take a full year sometimes to calm all the way down. There are also adjuvant treatments we can do while it's healing to help with redness, to help with raised scars. Or the best thing, though, is just to put the scar in a place that's the least obvious,
Right.
And give it time to heal. And I've had patients who are on the borderline between needing one sort of lift or another kind of lift
Right.
that's a little bit bigger with more scar. And I will do the lesser lift if they will allow me later to go back and do the bigger lift if they need it.
Oh, really?
And in
Oh.
those situations, the people who've gone back and had more scar are happier because the
Yes.
shape is so much better.
Yes.
So sometimes less is not better.
That's
I mean,
true.
less is, you could do nothing and get the ultimate in less,
Yeah.
but no improvement. So it's a balance between the improvement and what we have to do to get there.
Sounds good. All right, we're out of time already
Okay.
just for that segment, though.
Okay.
For more information about Dr. Mealy, you can call 925-943-6353 or check him out on the web at either drmealy.com or sanfranciscobreast.com. All right, lots more plastic surgery discussion coming up, so stay right here on Body Beautiful. We'll be right back. Lots more before and after pictures.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.